local and live. Covering Franklin and Washington counties, it's Let's Talk TriState.
Welcome to Let's Talk TriState, all powered by HomeRight Windows and Doors in Waynesboro, the right choice online at homerightwaynesboro.com. Joining us today, we have the CEO of Brook Lane. This is Jeff O'Neill. Jeff, how are you, my friend?
I'm good, Tiny. Thank you so much for having me.
It's great to have you today. Mental health is something that we hear a lot about, thankfully, but that we hear about it in a way of bringing awareness to it. And sadly, the need for it exists. A lot of the medical fields and mental health fields, I always say, I'm glad they're here, but I wish we never needed them.
Absolutely.
But we didn't get a chance to talk about this. Let's Talk TriState didn't exist at the time. But we're coming up on almost 2 years since the opening of Meritus Health's walk-in mental health clinic. And I think that's a big achievement. I think it's something that most of us probably wouldn't have had on our radar that would ever be something that we would need, we'd ever see. We did need it, do need it, and continue to need it. But take us through what that was like for that coming to fruition, that dream of a mental health walk-in clinic.
Sure. So back in 2022, at the height of the pandemic, or as the pandemic was rolling through its course, opioid overdoses was at an apex. Right. In Washington County, we had 114 people die of an overdose. Just tragic. And it comes from not having immediate access to care. When an individual wants treatment, they need to get it right then and there, or you miss an opportunity, and it's an opportunity lost that you may never get back.
Well, it is kind of emergent care for your mental health. You know, we get a cut or laceration, as it were, and the bleeding won't stop. We need to get to the ER. This is basically an ER for your mental health.
Absolutely. So we recognize with the substance abuse problem and need for crisis services, we also recognize for other mental health issues as well. An individual tries to call for treatment when they need it. They could be waiting 6-8 weeks to get in for a first appointment. So our attempt was to create crisis services for both substance abuse and for mental health that would provide immediate access to care.
Right.
And that was the premise that led to the dream, which led to the opening of our crisis center and our walk-in urgent care mental health center.
So for those who are listening and watching, what would you describe to them as something that you may qualify for needing help at the mental health walk-in clinic?
So at the mental health walk-in clinic, consider it an urgent care for any psychiatric problem you might have. Severe anxiety, panic attacks, depression, the fleeting suicidal thoughts where you feel life may not be worth living. Any issues that you're having that you feel can't wait for a traditional appointment, we're available. And walk-in is available without an appointment.
And obviously, if you have thoughts or ideations of harming others as well as yourself, as you said, with the suicidal thoughts, those would all qualify. Now, I saw a press release from April of 2024 that said that that the mental health walk-in clinic was off to a wonderful start with helping so many in our local area. I think at the time I saw a number of about 200. I don't know what that referenced, but obviously we're well past April of 2024. That's just over a year ago. So maybe you don't have specific numbers with you, Jeff, and maybe you do, but what are we looking at now that we are almost 2 years in? September will be 2 years for the walk-in clinic with numbers of our community helped.
So if you're thinking about, again, let's separate the two programs. The first is the Crisis Center for Substance Abuse. We have admitted to our crisis program, which is an average about 2-day stay with individuals with opioid or other addiction-related issues. We've served well over 300 patients a year. Approximately 360 patients per year is what we see go through that program. Our walk-in mental health center, that program is serving now approximately 30 to 40 patients per week. And the numbers are on the rise, so it's working quite well.
Back when I was younger, Brook Lane has been part of the local lexicon for however long. I mean, it's been around for years, since I was a child. I think it's one of those facilities that you know it exists. If you haven't needed it, though, you may have preconceived notions about what it is. Could you take us through a brief synopsis of Brook Lane, Jeff, if you would?
Oh, absolutely. Brook Lane's been around for 76 years, and it is an inpatient psychiatric hospital that serves children and adults, basically ages 8 and up. And for any mental health issues when they get admitted for that or need to be in a hospital setting for safety. We also have a whole array of services for outpatient services also. We do electroconvulsive therapy or shock therapy as others may know it. We do transcranial magnetic stimulation, which is an innovative process in which magnets are used to mimic what happens in electroconvulsive therapy, but it can be done without the use of anesthesia.
Okay.
It treats depression extremely well. Anxiety and OCD are other options for it as well.
So, take us, if you can, a snapshot of shock therapy. That's it's just electrodes, I'm assuming.
Yes.
Right. And what is it that the shock or the electric pulse does?
So the truth is, from a scientific perspective, I don't think people really know exactly how or why it works, but what it does is it resets the electrical impulses of the brain.
Yes.
So when that happens, it does have a positive effect on an emotional being of an individual, and it treats depression really well. So individuals who have been on medication for an extended period of time with very minimal or limited effect would be an excellent candidate for that.
Yeah. Kind of, I heard it put one time, it was almost like a soft reset of a computer.
Absolutely. That's a great way to put
We're
it.
doing a soft reset here, and we'll see where it gets you. And you're right. I think with that, again, with preconceived notions people have, they hear that it is this massive, oh no, shock therapy, because the way that it was done over 100 years ago was not the way it's done now. To your point, to the point where you don't even need anesthesia in the innovative care with the magnets. That's amazing. So, Jeff, if you would, what excites you about the future of Brook Lane, the partnership with Meritus, the walk-in clinic, the crisis center? What is it that excites you about what the future looks like?
Well, the future looks really bright for our community with the ability of us to offer the services that we do. Brook Lane, as I mentioned, been around for 76 years. Inpatient, outpatient, partial hospitalization programs, mental health, substance abuse, a residential program for children, 2 Type 1 schools. Sounds like a lot of resources available. Sure. Then Meritus has an inpatient adult unit. They have crisis counselors available in the emergency room 24/7, so that's immediately accessible. Yeah. The walk-in crisis center was developed in partnership with Brook Lane prior to the affiliation, which now Brook Lane oversees, and the crisis beds for substance abuse. When you take all of those resources together, and then you consider the direction that Meritus is going. So the School for Osteopathic Medicine will be bringing new doctors to the area. They'll be able to train their psychiatry components all at Brook Lane and at Meritus with this vast resources that we offer. And in addition to that, we also have a lot of resources that we plan to bring in as well. We've just been approved for a psychiatry residency program. Our first 5 residents have matched and will be here. And what that is bringing doctors that are already through medical school, training them to be psychiatrists, and then hopefully they'll stay in the area, which means more resources for our community. Wow. So it really looks bright.
That is absolutely incredible. I'm so thankful. Again, I hope I never need it, but I am just so thankful that those programs exist. And what I'm also glad about, and I think that our interview today, our time together, Jeff, has done this, is kind of lifted the veil a little bit and revealed that it is not, take your preconceived notions out of the equation. That's not the way that it is. This is just a wonderful approach to mental health, and it sounds like it's a network, a team, I don't know what you would want to call it, an ecosystem, so to speak.
A full continuum of care.
That's it, yes. I think that's the best way to put it. I have a feeling you've used that before.
Absolutely, which is what the affiliation with Meritus provided. It filled those gaps that we weren't doing with Brook Lane on its own.
Right. It's kind of interesting when you have these 2 entities that operate independently, and then it takes a realization at some point to say, we could probably help each other. We're on the same train, going the same way. Why don't we just finally meet up and see what happens. And you guys did that.
Absolutely.
Which is great. Well, thank you so much for joining us today, Jeff. It is a pleasure to have you. The website, which is on your screen, you can see it now. It is meritushealth.com/mental health. I encourage you to visit that website. I did over the past few days. There is a plethora of information, tons of resources. Again, you may not need it, but you may know someone who does. And Jeff has joined us today, been very gracious with his time. He's a CEO of Brook Lane in affiliation with Meritus Health. Jeff, thank you so much for joining us today.
Thank you, Tiny, for having me. I appreciate it.
Pleasure. And thank you so much for joining us on Let's Talk TriState.
Let's talk TriState.
If you'd like to be featured on an upcoming episode of Let's Talk TriState, call 717-597-9200 or email letstalk@921thegoat.com.